Just what is cancer? Cancer may start any place in the body. It starts off when cells grow unmanageable and crowd out standard cells. This makes it hard for that body to work the way it may. Carcinoma can be treated very well for most people. In fact, more folks than ever before lead full lifestyles after cancer treatment. Here we will explain what carcinoma will be and how it's treated. You'll find a list of words concerning carcinoma and what they mean all this booklet. Cancer Essentials. Carcinoma is not just one condition. There are many types of cancer. It's not just one disease. Tumor can start in the lungs, the particular breast, the colon, as well as in the blood. Cancers are usually alike in some ways, however, are different in the ways they will grow and spread. How are cancers alike? The cells inside our bodies all have particular jobs to do. Normal cellular material divide in an orderly approach. They die when they are used up or damaged, and fresh cells take their spot. Carcinoma is when the cellular material start to grow out of control. The particular carcinoma cells keep on increasing and making new cellular material. They crowd out standard cells. This causes difficulties in the part of the body, the location where the cancer started. Carcinoma cellular material can also spread to other body parts. For instance, cancer cells inside the lung can travel to the particular bones and grow presently there. When carcinoma cells propagate, it's called metastasis, metastasis. When lung cancer advances to the bones, it's called lung carcinoma. To be able to doctors, the cancer cellular material in the bones look just as the ones from the lung. It's not called bone tumor unless it started in the particular bones. How are cancers diverse? Some cancers grow and also spread fast. Others increase more slowly. They also respond to remedy in different ways. Some forms of carcinoma are best treated with surgical procedure, others respond better to medications called chemotherapy. Usually 2 or more treatments are accustomed to get the best results. While someone has carcinoma, a doctor will want to find out what kind of tumor it is. People with cancer will need treatment that works for their form of cancer. What are tumors? Cancer malignancy form a lump called a tumor or a growth. Although not all lumps are tumor. Doctors take out a piece of the particular lump and look at that to find out if it's tumor. Lumps that are not cancer are classified as benign. Lumps which can be carcinoma are called malignant. There are some cancers, like leukemia, cancer of the blood, that don't form tumors. They will grow in the blood cells or perhaps other cells of the physique. There is a fear that goes far through you when you're told you have carcinoma. It's so hard in the beginning to think about not your diagnosis. It's first thing you think about every morning. I want people with cancer to find out it does get better. Talking about your current cancer helps you deal with each of the new emotions you are feeling. Bear in mind, it's normal to get raised red flags too. Dolores, tumor survivor. What stage will be the cancer? The doctor also needs to realize if and how far the particular carcinoma has spread from just where it started. This is referred to as cancer stage. You may have read other people say that their tumor was stage 1 or perhaps stage 2. Knowing the period of the carcinoma helps a doctor decide what type of treatment is very best. For each type of carcinoma you can find tests that can be done to figure out the particular stage of the carcinoma. Generally, a lower stage, such as being a stage 1 or 2, means that the carcinoma hasn't spread very much. A higher amount, such as a stage a few or 4, means it offers spread more. Stage several is the highest stage. Inquire your doctor to explain the period of your cancer and what it indicates for you. How is tumor treated? The most common treatments regarding cancer are surgery, the chemotherapy, and radiation. Surgery can be used to take out the particular carcinoma. The doctor might also sign up for some or all of the physique part the cancer influences. For breast cancer, part, or all, of the breast could be removed. For prostate tumor, the prostate gland could be taken out. Surgery is not useful for all types of cancer. For example, our blood cancers like leukemia would be better treated with drugs. Chemo, short for chemotherapy, is the usage of drugs to kill tumor cells or slow their particular growth. Some chemo may be given by into any vein through a needle, and the like or a pill you take. Because chemo drugs go nearly all parts of the body, they are great for carcinoma that has spread. The radiation is also used to kill or perhaps slow the growth of tumor cells. It can be used only or with surgery or perhaps chemo. Radiation treatment is just like getting an X-ray. At times it's given by putting a seed inside the carcinoma to give off of the radiation. What was great for me was taking the time to be able to step back and see the big photo. Getting the answers to our questions helped me to make a very good decision. I did just what I wanted and necessary to do. I did items that made me feel comfortable, not just what others thought I necessary to do to be comfortable. Kevin, carcinoma survivor. Just what treatment is best for me? Your current cancer treatment will depend on what is best for you. Some cancers reply better to surgery, others reply better to chemo or the radiation. Knowing the type of carcinoma you will have is the first step toward realizing which treatments will work right for you. The stage of your tumor will also help the doctor make a decision on the best treatment for you. Any stage 3 or 4 carcinoma probably will respond better to treatments that will treat the whole body, just like chemo. Your health and the remedy you prefer will also play a part inside deciding about carcinoma remedy. Not all types of treatment is wonderful for your cancer, so inquire what options you have. And also treatments do have side effects, thus ask about what to expect with each and every treatment. Don't be afraid of questions. It's sure to know what treatments are most likely to aid and what their side effects could be. Why did this affect me? People with cancer usually ask, what did I do wrong? Or perhaps why me? Medical doctors don't know for sure the causes of cancer. When doctors cannot give a cause, people will come up with their own ideas concerning why it happened. Some people consider they're being punished regarding something they did or didn't do in the past. Most people think they did something to result in the cancer. If you're having these feelings, you're not alone. Thoughts and philosophy like this are common for people with tumor. You need to know that carcinoma is just not a punishment for your earlier actions. Try to not blame yourself or focus on looking for ways you could have prevented carcinoma. Cancer is just not your fault, and there are almost never a way to find out what induced it. Instead, focus on getting good care of yourself today. Your American Carcinoma Modern Society can tell you more about tumor and cancer treatment. Phone 1-800-227-2345 anytime, day or perhaps night. How to talk to your friends and family about carcinoma. It can be quite difficult to talk about carcinoma, even with individuals you love. Learning you have tumor can stir many thoughts, such as sadness, anger, and also fear. Sometimes it's challenging to know how you're feeling. A reduced amount talk to others about it. Your family may also have a hard time talking about tumor. It's not easy for them to really know what to say to help you or give you a sense of feeling better. Here are some tips to help you along with your loved ones deal with cancer. Tell your family and friends about your cancer as early as you feel up to it. At some point, they'll all know you have tumor. They might feel hurt or perhaps left out if they haven't been aware of it from you. When an individual talk to them, explain what sort of carcinoma you have and how it will probably be treated. Let them know that children can't catch it from you. Allow friends and family to help you, and inform them what kind of help you need. If you need a ride to the doctor's office or hospital, make sure they know. If you need help close to your house, let them know that, too. There could be times when you're not sure what you require. That's okay. Just let these know you aren't positive, but you'll let them know while you are. Tell the people who are closest you how you feel. This may not be effortless, but it can be a very important solution to get the support you need at any given time most. If you have difficulty talking about your feelings, you might find any support group or a mental health and fitness counselor to help you. If you will have friends or family who tell you to be able to cheer up when you're not feeling good, it may be okay to ask them to merely listen, and not tell you what direction to go. Sometimes you need to talk about what is going on without getting advice in turn. If some people are not alright with talking about your feelings, rarely be upset. Try conversing with others who might listen closely. You may not be able to carry out things you were doing prior to deciding to get carcinoma. If honestly, that is true, let your family and friends realize. It's best for your family and friends to help keep doing the things they did prior to deciding to have carcinoma. They should certainly not feel guilty about achieving this. If you're feeling unhappy or depressed, Talk to your medical doctor, nurse, or religious head. You can also call the U.S. Carcinoma Society at 1-800-227-2345. The first time you point out, "I have cancer" out loud is the hardest. The more an individual say it, the easier it can be to say the words. The more I talked about my breast cancer, the more it was for me to accept just what I was going through. I found it odd that I sometimes had to cute those I was showing about my carcinoma. Helen, carcinoma survivor. Cancer words you may notice. These are words that you may notice your carcinoma care crew use. Benign, any tumor that's not tumor. Biopsy, taking out a bit of tissue to see if carcinoma cellular material are in it. Carcinoma, cancer, a word used to describe greater than 100 diseases in which cellular material grow out of control, or a growth with cancer in it. The chemotherapy, the use of drugs to take care of disease. The word most often identifies drugs used to treat tumor. Sometimes it's just named chemo. Malignant, having carcinoma in it. Metastasis, metastasized, metastasized, the spread regarding cancer cells to remote parts of the body through the lymph method or bloodstream. Oncologist, a doctor who treats those who have cancer. Radiation therapy, the use of high-energy rays, just like X-rays, to treat carcinoma. Remission, when signs or symptoms of tumor are all or partly removed. Stage, a word that shows whether a carcinoma has spread, of course, if so, how far. How can I learn more about my carcinoma? If you have questions about tumor or need help finding assets in your area, please call the particular American Carcinoma Society from 1-800-227-2345. We're there when you want us, 24 hours a day, 7 days a week.